Hello everyone, welcome back to my channel. I'm Navjot Kaur, and in today's video we're gonna talk about OSCE. What is OSCE? What stations you will get in the OSCE? What you have to do in the OSCE examination. So if you are overseas nurse and want to sit in the OSCE exam and to become registered nurse in the UK, stick this video till end to get all the information about OSCE. So first of all, what is OSCE? OSCE is a objective structured clinical examination. It is a type of practical examination for the overseas nurses to become registered nurse in the UK. So let's start with the how many stations are there in the OSCE. So let's talk about the 10 stations that you have to perform in the OSCE. First, there are 4 stations. API. API include assessment, planning, implementation and evaluation. These 4 stations are connected to each other and there would be a single person's scenario. These 4 stations are based on the same scenario. A person's scenario will be given to you on some disease condition, and on the same disease condition, on the same scenario, you have to perform assessment, planning, implementation and evaluation, and there would be an actor on which you have to perform these 4 stations. So yeah, these 4 stations are connected to each other. Then there would be 4 clinical skills. 4 clinical skills you have to perform, and the scenario will be given to you. You have to perform based on that scenario. So then there would be professional values. In this also, the scene or the scenario will be given to you and you have to write the bullet points. What will you do in that situation or scenario? If that will happen in your ward, or that situation will happen when you are working, what will you do? So you have to write the bullet points. Then there would be evidence-based practice. In this also, a scenario will be given to you and you have to write the bullet points. What will you do in that scene, or how will you handle that situation? So these are the 10 stations that you have to perform in the OSCE examination. So now let's talk about all the station in detail. So let's start with the assessment. There would be 20 minutes for you to complete this station. Assessment is of 20 minutes and a real actor will be given to you. There will be an actor sitting on the chair on whom you will have to perform all the things included in the assessment station. So it is 20 minutes station and real actor will be given to you, and you have to undertake all the vital signs. Actually you have to take all the vital signs of that actor. You have to perform A to E assessment. A to E include airway, breathing, circulation, disability and exposure. You have to perform all these things in really you have to take all the vital signs and perform all the things and ask the questions about this to the actor and he will respond to you. So then after taking all these things, you have to do the documentation. You have to document all the vital signs on the News 2 chart or the GCS chart. These are the charts used in the UK for the documentation of vital signs. News 2 is for the vital signs and GCS is a neurological assessment chart which include vital signs and also the neurological assessment. So you have to do the documentation on these charts and the document should be correct. If you do the wrong documentation, they will fail you. Then after the documentation, you have to come back to the patient and tell all the results of the patient, what News 2 score you get, what GCS score you get of the patient, and what you will further do for the management if he has any irregular things in the vital signs. And then you have to conduct holistic assessment or comprehensive assessment, in which you have to ask questions to the patient about their physical, psychosocial, psychological, spiritual or sexual needs, if he need any help in that. So then after conducting the holistic assessment, you will complete the assessment station and you have to come out of the room. So this is your assessment station of 20 minutes. Within the 20 minutes you have to perform all these things, including your reading person's history. You have to read within the 20 minutes. There will be no extra time. So yeah, that's the assessment part. So let's talk about the planning station. This is our second station after the assessment, and in this station 14 minutes will be given to you to complete the planning station, and you have to write 2 care plans within the 14 minutes, and these care plans should be relevant according to the person's situation and disease condition. Situation or scenario will be given to you, and you have to write the 2 care plans which are relevant according to the person's disease condition or his situation, and you have to perform this station on the same patient you have done assessment. On same patient or same disease condition will be given to you in this, and you have to write 2 care plans which you have performed in the assessment. Same will be given to you, and your writing should be clear and legible so that they can read what you are writing. And yeah, there are certain ways to correct your mistake. If you have done any mistake while writing, there are certain ways according to NMC guidelines. Following that, you can correct your mistake. So yeah, that's the planning station, 14 minutes, and you have to write 2 care plans which are relevant according to the person's situation and disease condition. And also relevant risk assessment and referrals need to be included to pass this station. You have to write the referrals as well if you need to refer the patient to any team, any medical team, or to anywhere. So let's move to the next station. After the planning, there would be implementation station. 15 minutes will be given to you to perform this station, and there is no extra time for anything in this station. You have to perform everything within the 15 minutes. From administration of medicine to the documentation, you have to perform within the 15 minutes. Medication administration chart will be given to you in this station, and there will be medicines prescribed to your patient by his doctor, and you have to administer those medicines which are due to your time. And firstly, you have to follow all the correct principles of NMC guidelines during the drug administration. And you have to read the full prescription chart in front of the assessor. You have to read all the prescriptions, and then you have to dispense the medicine which are due to your time and which the patient need. And you have to be careful if patient have any allergy from that medicine, if there is any alteration to his vitals from that medicine you are dispensing, or if there is any overdose. You have to take care of all the things, and after the dispensing medicine, you have to go to the patient, and you have to carefully tell the patient about the indication and side effects of the medicine you are administering him. And after the administration, you have to do the documentation, and documentation should be correct. There not any mistake in the documentation. If we will do any single mistake in the documentation, they will fail us. So yeah, document should be very, very, very correct. We should be very careful while doing the documentation, and whatever medication you have given to the patient and whatever you omitted, everything should be documented. So yeah, that's the planning station, and you have to be very careful while administering the medicine and while doing the documentation, and there would be 15 minutes for you to complete this station. So after the implementation, there would be evaluation station. API is last station. Within the API, this is the last station, and overall this is the 4th station, we can say. And in this station, 8 minutes will be given to you, and this is the verbal station. In this station, you have to verbally give the handover to the other person. The other person could be a nurse, or he could be a doctor. Like, the person would be examiner, but he would act as a nurse or he would act as a doctor, and you have to give the handover according to that. Whoever the person is, nurse or doctor, according to that you have to give the handover. And within the 8 minutes, you have to prepare yourself for the handover, like making notes and give the handover verbally. Like, you can take 4 minutes to prepare your notes and 4 minutes to verbally give the handover. This is up to you. You can take 3 minutes for the making the notes and 5 minutes to verbalize. This is all up to you, how much time you want to take for making the notes or for preparing yourself, and how much time you want to verbalize the handover. So this is all up to you, and the assessor will not be interested in what notes you are making. This is all yours. You can make your notes anyhow. He will not check that. He will only assess what you are verbalizing. So just those things he will assess, and according to that he will pass or fail you. So this is the evaluation station. In this station you have to verbalize according to S bar. Like in UK we use S bar formula, or you can say method to give the handover. S bar include, S means situation. You have to tell the situation of the patient, like his name and why he came in the hospital or admitted in the hospital, and what is the reason of the handover and all. Then B for background, you have to tell the background of the patient, his history and all. Then A for the assessment, you have to tell all the assessments of the patient, initial vital signs, recent vital signs, what referrals you have done, what medication administration you have done. Everything will come in assessment. And R would be for recommendation. You will recommend the other person what you can or what you should do for the further management of the patient. So this is the evaluation station. So next are clinical skills. You have to perform 4 clinical skills in the OSCE exam to pass the exam. Overall there are 20 skills that you have to prepare for the OSCE exam, and 4 from those skills will be given to you in the OSCE exam to perform in front of the assessor. Before the September, there were 21 skills. In hospital, resuscitation was also there, but after the September, they removed that skill from the stations, from the syllabus, and now there are only 20 skills that you have to prepare for the OSCE exam, and each skill have different time duration. In that time duration, you have to complete that skill. And from these 20 skills, 4 will be asked to you in your OSCE exam. So yeah, you have to prepare these skills for your OSCE exam. After this, there would be professional value station. In this station, there are 15 scenarios you have to prepare for the exam, and from these 15 scenario, one will be given to you in your exam, and a scene or the scenario will be given to you. According to that, you have to write at least 6 bullet points within 10 minutes. 10 minutes will be given to you for this station, and in those 10 minutes you have to write at least 6 bullet points according to NMC guidelines and the code. You have to write the 6 points. What will you do in that situation? How will you handle that situation? So yeah, these are the 15 scenarios you have to prepare for professional values, and this is the written station. And the last one is evidence-based practice. In this station also 10 minutes will be given to you, and there are 15 scenarios. From these 15 scenarios, one will be given to you. You have to prepare all these 15s, and from these 15s, one will be given to you in your exam. And according to that scene or scenario, you have to write at least 6 or 5 points to pass this station, and you have to write what will you do according to the evidence-based practice if this situation will happen in your ward or while you are working in the ward. So yeah, this is 10-minute station, and this is the written station. Evidence-based practice according to the NMC guidelines, and according to the evidence-based practice, you have to write at least 5 or 6 points in this station. Yeah, that's the our last is station, evidence-based practice. So yeah, this is the OSCE exam. These things you will get in your OSCE exam. So this is the overall information about the OSCE exam and all the station. Next, I will also make other videos about detailed information about the each station and all the clinical skills, professional values, and evidence-based practice. So I hope I have covered all the things, and watch this video till end to get all the information. This is especially for the overseas nurses. And one more thing I want to let you know, that don't assume or think that you will get all the stations in this row, that first we will get API, then clinical skills, professional values, and evidence-based practice in the exam. No, they can ask you any station at the first and any station at the last. They can ask you evidence-based at the first, they can ask you clinical skills at the first. So be prepared like this, that you can do anything they will ask you at the first or the last. So yeah, that's all about this video. If you have any query or any doubt, drop your comment in the comments section. I will try to help you out in that. And keep supporting. Please subscribe my YouTube channel and like and share the video. And yeah, thank you for watching my video. Thank you so much. Bye bye.